Hey there, welcome. It is good to have you with me today. If you are going to be watching this, or if you are watching this as the replay, please take a moment to like the video and drop a comment. Maybe share it with a friend and subscribe to the channel. It helps to make these videos a little more visible to more people, and we want to get this information out there. So your help is truly appreciated. All right, let me just make sure I've got everything set up here. There's so many kinds of iridology, many iridology philosophies, but our focus today is specifically on the up-to-date, scientifically validated constitutional iridology. Why am I passionate about sharing this info with you and about teaching iridology? Well, my original training 45 years ago was North American iridology. My practice for the past 35 years has been constitutional. I had become frustrated with the diagnosing part of iridology that is stressed in the North American style. Then, just as I was about to quit doing iridology altogether, I was blessed to learn about constitutional iridology. I truly love teaching constitutional iridology in a very holistic way. In those years, I've added many credentials to my skill set, and I incorporate all of them to a certain extent in my teaching. So I just want to drop a little bug in your ear that our next course of dynamic iridology is starting on May 15th. It would be so cool to have you in that class. There's still time to register. If you're a health professional, a herbalist, nutrition coach, naturopath, chiropractor, medical doctor, RN, I want you to hear in that someone who has a college level anatomy and physiology course already completed, then you are in the right place to be learning iridology, and you are pre-qualified to enroll in the dynamic iridology assessment system program. If you're not a health professional, or if you don't have a solid foundation in anatomy and physiology, but you want to learn iridology, reach out to me and I'll coach you as to how to get ready to learn iridology. I'll send you a link to the A&P course that I recommend. So just before we start looking at eyes and learning about iridology and answering the 5 questions we need to answer to learn iridology, I want to share with you what some of my students have said. It's going to give you some context for what we're doing. Joyce Lee is a certified esthetician, clinical aromatherapist, chartered herbalist, and nutritional consultant. I took an iridology course from another school a few years ago, but I was left feeling inadequately trained and with no confidence in the material or my abilities to perform accurate assessments. Upon completion of Judith's course, I feel very confident in my abilities and excited to offer iridology services to my clients. This course is an incredible value, highly recommended. I am a level 3 certified iridology instructor through the International Iridology Practitioners Association. I started learning iridology and natural health in 1979 when I was starting to have some health problems of my own. And it just took off from there. It became what I wanted to do with my life. I was one of the first 3 level 3 certified iridologists in the world. To date, when I last checked, there was only 10 of us. There might be 11 now, but there's not very many. Over these years, since 1979, I've accumulated many different credentials, and I've written several books that were all self-published and self-distributed, and I've taught many different courses that I had designed as well in herbology, nutrition, pregnancy health, children's health, all kinds of things. And of course, my sweetheart course for the last nearly a decade has been the Dynamic Iridology Assessment System. I am also a master herbalist and a natural nutrition clinical practitioner. These are the different organizations I'm affiliated with. In 2022, I was voted by IPA as the Instructor of the Year, and in 2024, I was voted as the Iridologist of the Year. And I'm absolutely thrilled to be sharing information with you today. So what are those 5 questions that we're going to answer that will give us that introduction to iridology that we're looking for? What is iridology? Why does it work? What can it teach us? Why should health professionals use constitutional iridology? And how should it be used in clinical practice? So what is constitutional iridology? Well, it is the study of the iris of the eye, so the colored part of the eye. and it teaches us about the person's constitution, how they're put together. Modern iridology includes sclerology as well. We look at the eye, at the whites of the eye, to see the patterns and the blood vessels and different things that can show up on the surface of the sclera. Where the iris gives us information about the genetic potential, about your epigenetics, the sclera tells us where the problems are right now and can give us clues as to what the problems might be. In no way, shape, or form is sclerology or iridology diagnostic. Neither of them give us all the information we need to name diseases, but they certainly help us understand disease pathways. So why does iridology work? Well, your eyeball itself is the largest neural receptor of the body. So think of the optic nerve, and the very end of that, the receptor, the stimulus receptor, is the eyeball. The iris itself has 28,000 nerve endings. We're not sure what they all do yet. The eyeball develops embryologically at the same time the nervous system does. If there's a challenge in the body that the brain knows about, there's usually a marker in the iris, and there will often be something showing up in the sclera as well. With iridology, again, the challenges are inherent potentials, they're not guarantees. When we focus on the iris in today's webinar, so really just looking at the colored part of the eye, the irides teach us about inherent predispositions. This eye tells us this person is predisposed to spend a lot of time reacting in the sympathetic nervous system, fight, flight, or freeze. We may want to support that with something broad like astragalus, right? We want to support that nervous system. This person is predisposed to having her liver run the show. That's what the eye tells us. And that might show up as immune symptoms or blood symptoms, energy symptoms, allergies, hormonal issues, digestive issues, many different things, because the liver does over 500 different jobs. So we really have to understand anatomy and physiology in order to connect what we see in an iris with what the client's symptoms are. The iris teaches us what questions to ask. This client came to me with recurring bladder infections and allergies. Her eyes suggested an increased predisposition to allergies and infections because her liver may not want to do its job properly. That means that we need to work with her on a constitutional level, not a service level. Giving her herbs to fight infections would be a band-aid remedy. Instead, we need to go through the liver and use constitutional remedies. Consider using golden seal, a bitter herb that works well with getting the liver back on track. But we probably don't need to do anything beyond comfort measures for the bladder because it's only the messenger. Interestingly, she's been away from me for a few years and just recently connected with me in a panic because she had been breaking out in hives all over her body. Unfortunately, she waited too long to call and ended up in the urgent care clinic getting a prescription for prednisone. Had she reached out to me with the very first sign of hives, she's had them before, so she knew what was going on. We might have been able to short circuit the problem with herbs and supplements. Constitutional iridology does not enable us to diagnose. It does not give us disease names. It is best used as a guide to guide us to where the issues might be, and it guides our questions and informs our suggestions. Have you noticed I've not said anything like this person is toxic or this person needs to cleanse or this person has a congested liver? We haven't said these eyes look unhealthy. We can't possibly know those things from looking at the iris alone. We need to have a conversation with the client to understand what their symptoms are and what the person is already doing for their health. We need context to do an iris analysis. What can the iridology teach us? Well, again, the iris shows us the inherent predispositions, the epigenetics. The sclera tells us what the dynamic situations are. So this client has a very tight collarette. That suggests she's predisposed to constipation and poor energy production. However, we must ask the client. We never tell the client what she should be feeling. She might have already figured out that her body, long ago, that and maybe doing things that are supportive of it. This client was like that. She was already very diet aware. She ate small meals, lots of vegetables, very little grain, and good proteins. She was making good food choices overall. She also was using digestive aids as they were appropriate and had no gut symptoms when she came to see me. So she wasn't even constipated. Things were working well. Her eyes suggest another predisposition. This one is to the allergies, particularly in the mucous membranes. So I asked, and indeed, she has sinus symptoms, especially with the spring seasonal allergies. Constitutionally, her irides suggest a predisposition to leaky gut. Even though she has no gut symptoms, her allergies suggest we should work at healing her gut with something like maybe collagen. After a course of that, we may want to consider continuing to support her digestion at the stomach level with some betaine hydrochloride. And we may also want to do some various herbs to help mitigate the allergy symptoms. Why should health professionals use constitutional iridology? Well, we want to use it because it helps us connect the pieces to understand the process of what the body is genetically inclined to do and with what is actually happening. So we look at the constitution first. We only look at tiny bits if needed as a last resort. So we're not going to dissect our client. We're looking at constitution, which is much bigger than a dissection would allow us to do. Constitutional iridology helps us to see how to balance using cleansing and nourishing. That's important. And it helps us to understand how to alter programs as warranted, because it helps us understand the pathway of the disease process with this client. It also helps us to know what we need to be doing at what stages. It helps us avoid slicing and dicing or subdividing the body into tiny parts. Again, we're looking at the whole. This is holistic. To that end, you will notice that the dynamic iridology map, which is a constitutional map in its truest form, only shows organs and tissues that affect metabolism in some way. We don't do the knee, the hip, the foot, the arm, the hand, the earlobe. We only look at organs that have a metabolic balance, which is all of your internal organs, but it's not necessarily all of your structure. How should iridology be used in clinical practice? Well, this is a woman who is in her mid-50s, and let's just do a quick case study here to show you how this works. She has her diet figured out quite well and has a very holistic lifestyle. She wants to get rid of hot flashes. Her eyes guide me in two directions. So I asked her first about her nervous system, her adrenals, her sympathetic response, sleep, how she regenerates, how she handles stress. Any symptoms with stress? Yes, the hot flashes get worse. That was her primary concern. She wants to get rid of hot flashes. The second thing I noticed with her eyes is her liver predispositions. So I asked her if there's any problems digesting fats, any anger issues, any holding a grudge, and she says no. I recommended to her that she give up coffee for 10 days. That was the biggest thing in her diet that wasn't really great. She did, and she had vast improvement from that. The hot flashes were almost gone, like very minimal, and warm waves instead of hot flashes. But she liked her coffee so much that she'd rather keep the hot flashes and the coffee than give up the coffee to get rid of hot flashes. Now, the caffeine is stressing her adrenal glands and depleting her B vitamins. Adding B vitamins wouldn't be enough to balance out the hot flashes. No, there's no supplement strong enough to hide the effects of the caffeine in a case like this. There's lots of other markers in her eyes that suggest insufficiencies with the liver and issues with managing her carbs and her blood lipids. There's things here that suggest some circulatory congestion and insufficiency and increased risks of digestive challenges and spinal subluxations. Those were issues for another appointment. I don't try to do it all in one session. It would be too overwhelming for the client. Instead, focus on the eyes and how the eyes inform me about the immediate situation that the client's asked for help with. When I get good results from the first session, clients always come back for more. This is a gentleman who is now 64 years of age, 5 feet 11, weighs 200 pounds. In the top photo, which was taken in 2014, We can see that we've got a lot of the same markings that we have in the bottom photos that were done in 2020. Now, we can't use these for before and after photos because they were different cameras and different lighting, right? And that will affect the way we see the color and the colors that are produced as our output. In 2022, when he came to see me, he came in a panic because he hadn't done his homework from 2014 yet, and he was now bearing a diagnosis of prediabetes. His sugars were averaging 7 and as high as 7.5. The metformin the doctor gave him diarrhea, switched him to Glumetza, which worked a little bit better, but now he had low potassium. He also had elevated blood pressure. He was on hydrochlorothiazide, which is a diuretic, and trandolapril. He was also on Mylan torvastatin because his cholesterol was elevated. He was on sildenafil, which is Viagra, because the blood pressure medication made it so that he could not have an erection. So with all of this, what we find is that he's got a lot of complicating factors because blood sugars can also affect sexual performance, right? He was also on Glumetza, as well as he was on Glumetza, which is just another form of metformin, and Giardians, which is also for blood sugars. His glomerular filtration rate was very low normal, which suggests he might be at the edge of early kidney disease. Now, I can't diagnose that. That would be up to his doctor, but I know that's what a low eGFR means. His hemoglobin A1C was 7.2. We need that to be below 5.7. At 7.2, he is well and truly into prediabetes, if not full diabetes. So his cholesterol was coming down with the medications, but he did not like these numbers, and neither did I. When we look at everything that's going on, most of it is diet and lifestyle related. So we needed to figure out what needed to happen here. His eyes show us, these brighter photos at the bottom show us that he tends to run too acidic in his system. I have to wonder how much that is going to aggravate the GFR. And of course, if his GFR is low, that excess acid that he carries is going to lead to more inflammation. Inflammation is going to aggravate the insulin resistance and increase his endothelin, which is a vasoconstrictor, and his aldosterone. So it's all going to lead to higher blood pressure. And he has a potentially under acid stomach. So we needed to talk with him about reflux, and we're going to talk about that in a moment here. So I recommended that he clean up his breakfast, which up until this time was usually a sugar sweetened cereal with some juice. His lunch was usually a sandwich on white bread or some kind of takeout food. And supper was often fast food or delivered food because his wife is a flight attendant, and she's often gone on 4-day pairings. And so when she's not around, he just does the bachelor thing and orders in. So I recommended that he get more vegetables, including fermented vegetables. And I told him of a store that makes wild fermented vegetables. I wanted him to add protein to his breakfast and get rid of his coffee. He was drinking a couple cups of coffee a day. We especially increased his leafy greens, and we got him to start exercising. We just had him do some resistance training for about 20 to 30 minutes a day. We know that resistance training helps to reduce insulin resistance. I recommended for him that he use L-arginine, which is a vasodilator, and berberine, which helps to enhance insulin acceptance. With the diet work, a little bit of exercise, and those supplements, after 3 months, his hemoglobin A1C had dropped to 5.9. That's an amazing drop. His doctor was so impressed, he promised that if these numbers kept improving, they would start taking drugs away. So what I noticed when he was with me in the appointment was he did a lot of clearing of his throat, which makes me wonder if he has reflux. So we tweaked his program a bit, gave him some help digesting his proteins, and kept him on and his vegetables as well, kept him on the berberine and the L-arginine. I also suggested he get evaluated by a chiropractor for a locked diaphragm, which I felt he probably had, and that was probably making the reflux worse. So after 6 months, he did get his diaphragm checked, by the way, and got it corrected. After 6 months, the doctor took him off the hydrochlorothiazide and the Glumetza. So we were excited about his progress. So how do we use iridology? Well, we use it to guide our questions, to help create rapport, and to inform the recommendations we are going to make. Here's another one of my clients, 44-year-old female. She has a diagnosis of polycystic ovarian syndrome. She has 2 children, ages 8 and 10. Now she's 5'10" tall and she weighs 275 pounds. So she is obese. She's not happy with that. But because of the PCOS, she seems to be unable to lose weight. She's got the excessive hair growth that accompanies PCOS, and she doesn't like that. She has fatigue and depression. She's on a prescription for antidepressants. Her menstrual cycle is not really regular. It can be anywhere from 4 to 6 weeks apart. She was born without an ileocecal valve, so we've got some compromises in the intestinal tract. She also has rosacea, which is an autoimmune condition. And she's worked with a nutritionist before, but she didn't like the one-size-fits-all approach of that nutritionist. So focusing only on markers that give us information about what she wants help with, and to help us trace back her symptoms trace back the problems to the roots of her symptoms, here's what we found. She has a biliary constitution. That means her liver wants to run the show. She has anxiety tetanic, which means she burns through B vitamins, vitamin C, calcium, and magnesium. She has extra little bits of brown pigment in her eyes. And these increase her predisposition to the MTHFR defect, which means she can't use regular B vitamins. In her left iris, at about 25 minutes in zone 3, we've got a little marking in her ovary area. In her right iris at zone 3 again, at about 34 minutes, we've got another marking in her ovary area. That doesn't mean she has to have PCOS, but it does mean that her ovaries are a weak link. And so we want to be aware of that. When we look at the whites of her eyes, we see that she's got what we call a fungal labyrinth. This suggests that she's working with fungi in her body. She's got the very beginnings of some fermentation signs, and she's got a bit of an uneven yellow haze in her eyes. That's all I needed to see. So I got her onto a methylated B complex and some N-acetylcysteine. I got her off her big box brand gummy melatonin and her gummy vitamin D and her gummy multivitamin and her gummy vitamin C. Those things are so loaded with sugar. Her food intake was sporadic and sloppy. Really, we were starting from scratch to establish good nutrition. So we had to start small. She wasn't hungry at breakfast time, so I wasn't going to push breakfast on her. Lunch was typically a soup or a salad or a sandwich, usually on white bread. So I suggested that she use homemade bone broth-based soup, which she was willing to do, and make sure it's got a lot of protein and vegetables in it. For supper, I recommended protein and vegetables. She used to have a lot of rice with her supper, and I had her get rid of the rice and instead add a lot of low-carb veg. We had her work on getting 2 liters of water per day, and recommended that she start walking for 5 minutes after each meal and increase that by 2 minutes per walk each week, so that eventually we'd have her walking easily 30 to 40 minutes after each meal. At 4 weeks, she was really liking lower carbs, and her digestion was feeling so much better. Her energy was up, her body shape was changing, and her clothes were much looser. She was only down 4 pounds, but she was losing a lot of water volume off her body. She'd stopped the antidepressant on her own, and she was feeling happier. Her husband said that without the antidepressant, he noticed that she was sleeping more peacefully, and she was waking up with more energy. So now we added collagen to her program. So 4 weeks later, she was down another 4 pounds. She had never lost weight consistently over 2 months before. Her clothes were very loose. She was down 2 full pant sizes and only 8 pounds. That's pretty remarkable. That's a lot of inches coming off. The doctor, she had some labs done, and the doctor said they were the best he'd ever seen them, and whatever she was doing, keep on doing it. So we built her program slowly. In this appointment, we added some omega-3. So in order to create programs in client sessions using Iridology, we must understand what the client wants help with. We must understand where they're starting from, and we must understand how the body works and how the organs work with or against each other. This is why it's critical to have anatomy and physiology under your belt before you start learning Iridology. With the exception of anatomy and physiology, I can teach you everything else you need to know about Iridology. So our next course is starting on May 15th again. It is the only live, online, fully mentored course for nutritionists, herbalists, naturopaths, RNs, EMTs, physical therapists who want to streamline their clinical work without sacrificing client care. For practitioners who want to be able to assess their clients and develop a starting program right in that first session, no extra time needed, and also to be able to build their program step by step as they find their client is getting results. The Dynamic Iridology Assessment System for Health Professionals is a 20-module class. We have one module per week, about 2.5 hours per module in live webinar interactive classes recorded for playback on demand. Every session, of course, is recorded. So important that you have access to that. We have live group mentoring twice each month via an interactive webinar. This is where this is where students can bring questions, cases, business questions, whatever they're needing support with as it relates to Iridology. We have, it's not actually on MeWe anymore, we have a private student support group, a social media group, a community, if you will, but it's not on Facebook, it's not on MeWe, it is truly private, so we can speak our minds freely. Students receive also a 225-page digital textbook for studying it. I left it digitally so that whenever we need to update the curriculum, we can. I'm in another course right now, and I had to buy the textbook, and the textbook is 25 years old, and it does not agree at all with what the instructor is saying. It is so different, and the instructor produced this textbook. It's frustrating to have a textbook that doesn't match the curriculum. I won't do that to my students. You get an up-to-date digital textbook. 45 pages of digital study notes. We call these the cheat sheets. Also my gift to you. IFAS certification mentoring is also included. I really do encourage my students to get certified. It proves that you know what you're talking about. It involves mentoring, it involves an exam, and I include that in your tuition. Kimberly Zadalis is one of my certified graduates. She's actually just recently certified level 3, which is amazing. At the end of Dynamic Iridology, which is the equivalent of IPA level 1 and level 2, she said, if you are wondering which Iridology course to take, you can stop looking. You've found it. Judith Cobb is an excellent instructor with many years of experience. She's a caring and compassionate person who is dedicated to the field of Iridology and her students. I personally practice both Eastern and Western physiology medicine and was very impressed with the layout of her program. She makes it easy for her students to balance work and life and study. So again, that course is starting on May 15th. And in order to enroll, we need to have a meeting, a private one-on-one meeting, so that we can go over who you are and what the course is all about and make sure it is really the best fit for you. I look forward to speaking with you soon. Make it a great day. Bye for now.